Can physical therapy really help knee arthritis pain? That's one of the most common questions that I get from new patients. Hi, I'm Dr. Dave Candy, and in this video, I want to show you how you can be your own physical therapist and make big differences rather quickly in your knee pain. Many people have trouble wrapping their head around how doing exercises can help their knee arthritis because arthritis is inside your joints. It's not in your muscles. But keep in mind there's a difference between radiological knee arthritis and clinical knee arthritis pain. And there have been studies with wide results comparing people who have knee pain and people who have knee arthritis. And the ranges of overlap range anywhere from as low as 15% to as high as 80%. But what it does go to show is they don't necessarily match up. So just because you have knee pain doesn't necessarily mean that you have knee arthritis. And just because you have knee arthritis doesn't necessarily mean that you're going to have knee pain. Furthermore, if you do have knee arthritis and you happen to have knee pain, it doesn't necessarily mean that the arthritis is the cause of the knee pain. Now, arthritis itself doesn't have to be painful, but it's often abnormalities of movement that cause that arthritis to create inflammation inside your joint. And that can be painful. But in this video, I want to show you how you can be your own physical therapist and get your joints moving better if your knee pain actually is from your knee arthritis. Now, many people think of the knee like a hinge joint, like it just moves back and forth as a simple axis of rotation. But your knee actually has 6 degrees of freedom. And that means that it can move around 3 axes. So it can rotate around an axis this way. It can rotate just a little bit around a side-to-side axis. And then it can actually twist inwards and outwards a little bit as well. So while your knee joint is mostly a hinge, it's a really complex hinge. There are 3 different compartments in your knee, and you can have arthritis in any and or all of those. So you have an inner compartment right here, you have an outer compartment over there, and then you have a compartment between your femur or your thigh bone and your patella or your kneecap, which is called the patellofemoral compartment. And usually it's either the patellofemoral compartment or the medial compartment, which cause the most common sources of knee pain from knee arthritis. So here are some ways that you can use manual physical therapy, meaning using your hands on your own to get those little tiny accessory movements moving better. The small rotations around the axis and the small side-to-side movements. Furthermore, you can get translation of your knee joint. So it can actually move like this, where your tibia shifts sideways to the inside or sideways to the outside. And that malalignment of the joint can create pain when you're walking. But the good news is that by changing some of those small little malalignments, you can make big differences rather quickly in your knee pain. So let's first talk about the just very basic accessory movements that happen in your knee. When you straighten your knee, your tibia, it rolls forward like this, but it also kind of glides upwards. Now, if you're having trouble straightening your knee because of knee arthritis and you can't get it to straighten all the way, it's not usually a hamstring problem, particularly if that happens if you can't get it straight when you're standing up and walking, or when you're laying down, if you can't get your knee to lay all the way flat. That's not a hamstring problem because your hamstring's not all the way stretched unless your leg is up like that. So if you have a true joint problem where you can't straighten your knee all the way, then here's something simple you can do to help do your own manual therapy and get your knee to straighten more. So you want to take a towel and put it underneath your knee. You don't want to leave a big gap in your knee. And because the tibia or the lower leg bone glides forwards, you want to put it just below the knee, underneath the tibia. You want to have enough towel there that it kind of fills what gap there is, but you're not directly behind the knee, you're just a little bit below the knee. That way, when you go to apply pressure, this is stabilizing the tibia just below the knee joint. Now, when you go into extension, your tibia is going to glide forwards, your femur is going to glide backwards. So it's this direction of a motion on your knee. Additionally, when you get into the last few degrees of knee extension or knee straightening, your lower leg bone or your tibia rotates outwards a little bit into external rotation. So to help get those movements moving better so that you can straighten your knee, here's what you do. You take one hand and put it up on your thigh and just kind of press down like this. So you're putting pressure down that way. If you need to use your other hand, you can, but you're probably going to want to have this other hand free if you're able to. Now, with the other hand, you kind of grab around the tibia. So you have one hand on the femur, one hand on the tibia, and then you're going to rotate this hand inwards while applying a little pressure, while rotating the lower leg bone outwards. It's going to be a motion, kind of a twisting motion, while also pushing with this hand. So you twist like that, and then just press this way. Now, this is not a huge motion. The joint mobility is really, really tiny, about 1/8 of an inch. So you're not going to get a whole lot of movement. It'll probably just feel like you're pressing up a resistance that really won't go anywhere. It's important to have this towel because you're not trying to press the leg down like that in an arcing motion. It's a gliding motion like this. So again, one hand on the femur, one hand on the tibia, kind of between the tibia and the towel, and then you're pushing down with this hand while turning outwards with the other hand. And so that's a little self-joint mobilization to get your knee joint to extend or straighten better. Now, what about bending? Bending usually doesn't affect people with knee arthritis quite as much as they would think. It's not that often when we get into positions of full knee bending, but occasionally you do have to get in positions where you're either getting out of a car and you need to bend your knee a little bit more, or you're going up a high stair and you need to be able to bend your knee a little bit more, or you're squatting down and you need to get more bending out of your knees. In those situations, there are times when you need a little bit more knee bending than just, say, the 90 degrees that you would need to sit. So if you're having trouble bending your knee, a very common physical therapy exercise that people do is doing just a heel slide where you pull your leg up with a towel like this, sliding your heel on the table. But that, again, kind of treats this like a hinge joint, where it's just rotating like a hinge on your door. But again, there's some rolling and gliding that happen at the same time. And when you bend your knee, your tibia moves backwards this way. And as you start getting into further degrees of bending, it starts to rotate inwards this way as well. So it does this type of motion and that type of motion at the same time. So you want to bend your knee up to the point where you can comfortably. You don't want to pull it and arc it as hard as you can. Just bend up as far as you can comfortably. Then you're going to place your hands around the front part of your tibia. Put the inner hand on first. So if it's your right knee, you want to use your left hand on first, and then your right hand over top. Then you're going to pull, not in a arc motion like that, but in a straight line motion. So you're pulling inwards, and then pull this inner elbow towards your opposite hip a little bit so that you're torquing the tibia a little bit. So you're twisting it inwards at the same time as you're pulling backwards. And again, this is just a very tiny little movement. Do this for 30 seconds or a minute or so. Just little oscillations back and forth like this. This should not hurt because you're not bending it to the end range again. You're just doing little oscillations, pulling back like this. And then after you've done that, see if you can bend your knee just a little bit more. So now you are kind of arcing it a little bit, but not to the point where it's incredibly painful, just taking up the slack and going to a new end range, and then you repeat. So do that little inward rotation and then backward translation. And repeat again for 30 seconds to a minute. And just keep repeating that process, doing the little oscillations and then taking up the slack until you feel like you get to a point where you're no longer improving. And so that's how you improve your knee bending. Now, what about side-to-side motions? When you're walking, if you twist your leg inwards or if you overpronate your foot, then what can happen is you create some twisting and some shearing at the knee joint. And that can cause your tibia to either shift inwards or shift outwards on your thigh. So there are a couple different ways that you can assess what way the problem is. One is just to slide your hands down and see if you feel for an offset. Like you slide off and then there's something sticking out on one side or on the other side. In my case, it's sticking out a little bit on the outer side, but we'll pretend that it's sticking out on the inner side first. So to fix that, just sit with your leg like this. You can do this sitting in a chair with your foot on the floor too. You're going to take the side that's sticking out. So again, we're pretending it's prominent on the inside. You're putting that hand on the inner side of the lower leg bone or the tibia, the other hand on the outer side of the femur. So it'll look like this. And then you're just shearing, pressing in with one arm and out with the other. So going like that. Now, what if it's sticking out on the opposite side? Well, the process is just the opposite. You'll push on what sticks out, stabilize above the knee with the other hand, and then press this way. Again, just little oscillations. And these are little tiny micro movements that get the knee joint lined up properly so that the two sides of the knee joint are moving the way that they should. And that can often quickly decrease your knee pain just by doing those little things. Now, the final compartment that we haven't talked about yet is that patellofemoral compartment, the compartment between your kneecap and your thigh bone. And normally, as you straighten and bend your knee, as you straighten your knee, the kneecap comes up this way. As you bend your knee, the kneecap goes down that way. So when you straighten your knee, the kneecap needs to be able to glide up towards you. When you bend your knee, the kneecap needs to be able to move down towards your foot. So you can do that just by sitting with your leg out straight. If it won't straighten all the way, then put your towel roll behind the knee again, just to fill the gap. Then you want your leg completely relaxed here. You don't want your thigh muscles to be tense. And then push downwards like that with the patella going down towards your foot to help improve knee bending, or pull towards you, kind of grip your fingers underneath the kneecap and pull up towards you like this to help improve knee extension or straightening. Another common problem you might see is that the kneecap might point outwards or squint outwards a little bit. It looks like this one might be doing it just a little bit more. So I'll show you on this knee. If your kneecap is tipped outwards such that it's facing toward the outer side, then what you want to do is put a little bit of pressure with your palm on the inner side of the kneecap while lifting up on the outer side of the kneecap. So you're kind of trying to tilt it like that. And this is good for people who have pain on the front of the knee, or particularly have pain on the front outside of the knee. For example, from IT band syndrome is a common thing that can cause that kneecap to tilt outwards. And you just go like that. So those are some physical therapy treatments, some self-joint mobilizations that you can use to help improve how your knee joints move to decrease arthritis pain. Now, I would recommend, if you're having really bad knee arthritis pain, to go see a manual physical therapist to get this done in person and or show you in person how you can do it and which techniques are going to be best for your body. If you happen to be in the St. Louis area, we'd be happy to do that here for you at More for Life. And no matter where you're watching this video from, if you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.